You're listening to The Resilient Animal. I'm Annie Peterson, Doctor of Education with a Master's in Mental Health Recovery and Trauma-Informed Care. This podcast is an exploration of how helping other living beings can benefit human mental health and well-being, and what makes us all resilient animals.
This episode will take an honest look at what it really means to dedicate your life to caring for animals. Please take care of yourself while listening, and listener discretion is advised. Before we begin, I want to take a moment to acknowledge that today's episode covers some heavy topics, including mental health, compassion fatigue, and suicide within the veterinary and animal care professions. If you or someone you know is struggling, please know that support is available. The 988 Suicide and Crisis Lifeline is available by simply dialing or texting 988 in the United States. We'll share more resources at the end of the episode. Now, close your eyes for a moment. Think back to when you first fell in love with animals. Maybe it was a childhood dog who slept at the foot of your bed, or maybe it was a rescue kitten you bottle-fed through the night. There's a reason so many of us are drawn to this work. Animals offer something that human relationships sometimes cannot: unconditional presence, wordless comfort, and a kind of love that asks for nothing in return. But what happens when that love becomes your job? Today, we're going to talk about the full picture, the beautiful and the stressful of working in animal care. We'll explore the gap between the passion that draws people in and the reality that burns them out. We'll look honestly at the mental health crisis gripping the veterinary profession, including the devastating rates of suicide among veterinarians. We'll discuss humane euthanasia, what it means, what it costs the people who perform it, and how to carry that weight. And we'll explore something that doesn't get talked about nearly enough: the fact that many people enter animal welfare not just out of love for animals, but as a way of healing themselves, and what happens when the job makes that harder, not easier. This is a conversation the animal care world needs to have, so let's have it. Ask almost anyone who works in animal care why they chose this path, and you'll hear some version of the same answer. I've always loved animals. I wanted to help them. I couldn't imagine doing anything else. And that's beautiful. That love is real and it matters. But our culture has done something interesting with it. It's wrapped the entire profession in a warm, golden haze that doesn't quite match the truth. Think about how animal care is portrayed in the media. Wholesome veterinarians on reality TV shows, gently stroking a recovering puppy. Wildlife biologists wading through rivers to tag salmon. Shelter workers tearfully reuniting a lost dog with her grateful family. These images are real. These moments do happen, but they represent a tiny fraction of what the work actually looks like day to day. The creative image of animal care work is built on several pillars. First, the idea that working with animals is emotionally uncomplicated, that animals give love freely and without the messiness of human relationships. Second, the belief that the work is primarily joyful, that you spend your days surrounded by cute animals who are grateful for your care. Third, the assumption that the work is straightforward, that if you love animals enough and you're good at your job, things will usually turn out okay. And fourth, perhaps most damaging of all, the notion that people who work with animals are somehow protected from the kinds of mental health struggles that affect other professions. Because how could you be unhappy when you're surrounded by animals? These are the stories we tell ourselves before we enter the field. And for many people, the first few years of working in animal care feel like a confirmation of the illusion. The work is hard, but it's meaningful. The hours are long, but the reward of a successful surgery, a successful adoption, a successful rescue makes it all worthwhile. But then something shifts. Let's talk about what animal care work actually looks like. Not to discourage anyone, but because the gap between the illusion and the reality can be one of the root causes of the mental health crisis we'll be discussing throughout this episode. The first reality is physical exhaustion. Veterinary medicine, shelter work, wildlife rehab, and animal agriculture are physically demanding professions. Veterinarians and vet techs are on their feet for hours at a time. They lift, restrain, and handle animals of all sizes, often animals who are frightened and in pain. Musculoskeletal injuries are common. Exposure to zoonotic diseases, illnesses that can pass from animals to humans, is an occupational hazard. The physical toll of the work is real, and it accumulates over years and decades. The second reality is emotional labor. Every single day, animal care workers make decisions that carry enormous weight. A veterinarian in a busy small animal practice might see 30 or 40 patients in a single shift. Each of those patients has a family who loves them. Each case carries the possibility of a good outcome and the possibility of a tragic one. Vet technicians hold animals during painful procedures, clean wounds, administer medications, and offer comfort in the last moments of a patient's life. Shelter workers intake animals who have been abused, neglected, or abandoned, and they do it again and again and again. Emotional labor is the work of managing your own feelings in order to be present for someone else's needs. It's the smile you put on when a client is rude to you. It's the calm you project when an animal is terrified. It's the professional composure you maintain when you're delivering news that will break someone's heart. Emotional labor is invisible, it's exhausting, and in animal care professions, it's constant. The third reality is client conflict. The relationship between veterinarians and pet caretakers is one of the most emotionally charged dynamics in healthcare. Pet families love their animals deeply, and in many cases, their pets are their primary source of companionship and emotional support. When those animals are sick, owners are frightened and grieving. That fear can come out as anger. Veterinary professionals routinely face clients who are verbally abusive, who dispute diagnoses, who threaten to report them to licensing boards, or who simply cannot understand why their pet isn't getting better despite everyone's best efforts. And then there's the money. Veterinary care is expensive, and many pet owners are caught between their love for their animals and the limits of their budgets. Veterinarians are frequently placed in the agonizing position of recommending a treatment they know could save an animal's life, but due to financial constraints, the owner cannot afford it. This often results in the animal not receiving treatment, and rather than having the pet continue to suffer, they perform something called economic euthanasia. It is one of the most morally distressing aspects of the profession. The fourth reality is financial strain on the practitioners themselves. The average veterinary student in the United States has somewhere between $150,000 and $200,000 in student loan debt. Yet starting salaries for veterinarians, while not poverty level, are significantly lower than those for human physicians, who carry similar educational burdens. The debt-to-income ratio for new veterinarians is among the worst of any profession. Many veterinarians spend the first decade or two of their careers in significant financial stress, even as they're expected to maintain the professional composure and equanimity of someone who chose this work purely out of love. The fifth reality is what researchers call compassion fatigue, and it deserves its own careful consideration. Compassion fatigue is a form of secondary traumatic stress that affects people who regularly witness the suffering of others. It was first described in nurses and first responders, but it is now well documented in veterinary and animal care professionals. Compassion fatigue looks like emotional numbness, like losing the ability to feel moved by things that used to affect you deeply, like going through the motions of caring without actually being able to feel the care anymore. It looks like dreading the work that you once loved, like feeling nothing when you should feel something, like a hollowness where your passion used to live. This is the reality that the fantasy doesn't prepare you for. This is what happens when you pour your heart into a profession for years and years, and the profession takes more than it gives back. And yet, this is not the whole story. Because even knowing all of this, most people in animal welfare say they wouldn't choose a different path. The love for the work, for the animals, for the moments of genuine connection and healing, it persists even through the hardest seasons. Understanding the reality of the work doesn't mean abandoning the love of it. It means honoring that love with honesty, with support, and with the kind of care that we so readily extend to our patients and so rarely extend to ourselves. Let's take a moment to pause because what we're about to discuss is serious and it matters deeply. If you are struggling right now, please reach out. The 988 Suicide and Crisis Lifeline is available by dialing or texting 988 or dial 911 for emergency services. You are not alone and you are not a burden. The veterinary profession is facing a suicide crisis. This is not an exaggeration, and it is not a new problem, though it is one that the profession has only recently begun to confront openly. The data is sobering. Studies in both the United States and the United Kingdom have consistently found that veterinarians die by suicide at rates significantly higher than the general population and higher than most other healthcare professions. In the United States, male veterinarians are approximately 2 times more likely to die by suicide than the general male population. Female veterinarians are approximately 3.5 times more likely. In the United Kingdom, those numbers are even more alarming, with some studies finding rates 4 times higher than the general population. Let those numbers land for a moment. The people we turn to care for the animals we love are dying by suicide at rates that should alarm every single one of us. So why? What is it about this profession? A profession built on healing, on compassion, on love for living things that creates such devastating risk? Researchers and clinicians have identified several contributing factors, and it's important to understand that no single factor tells the whole story. This is a complex, systemic problem. The first factor is the culture of perfectionism and stigma. Veterinary medicine, like human medicine, has historically cultivated a culture that prizes stoicism, self-sufficiency, and perfection. Medical professionals are trained to be the person with the answers, the person who stays calm in a crisis, the person who doesn't break. Asking for help, especially mental health help, has long been seen as a sign of weakness, a threat to professional credibility, or evidence that you can't handle the demands of the job. Some veterinarians have reported fearing that disclosing mental health struggles could affect their licensing, their professional reputation, or their ability to be taken seriously by colleagues and clients. In a profession where your credibility is your livelihood, that fear is not irrational. It is a product of a system that has not yet caught up to what we know about mental health. The second factor is moral distress. This is a concept that comes from nursing ethics, and it describes the psychological suffering that occurs when you know what the right thing to do is, but you are unable to do it. In veterinary medicine, moral distress is pervasive. Veterinarians are regularly placed in situations where they must choose between what is medically ideal and what is financially possible. They are asked to perform euthanasia on healthy animals when owners cannot care for them, or when shelters are at capacity. They witness suffering that they have the skills to relieve, but not always the resources. They are held to a standard of perfection while being resourced to provide something far less than that. Over time, chronic moral distress erodes a person's sense of meaning and purpose. It creates a kind of internal dissonance, a gap between who you know yourself to be and the actions you are required to take. That is deeply damaging to psychological health. The third factor is the debt burden we touched on earlier. Financial stress is one of the most well-established risk factors for depression and suicide. When you combine the weight of six-figure student loan debt with a profession that offers moderate salaries and high emotional demands, you create conditions that are genuinely dangerous for mental health. The fourth factor is isolation. Veterinary practice, particularly in rural areas, can be profoundly isolating. Solo practitioners may go days without meaningful adult conversation outside of client interactions. Even in larger practices, the culture of stoicism means that colleagues rarely talk openly about their struggles. And in a profession where everyone is busy, where the needs of animals and clients are immediate and constant, there is rarely time to check in on each other in any meaningful way. The fifth factor is the specific emotional weight of working with death. We'll explore this more next, but it's worth naming here. Veterinarians and animal care workers are in close proximity to death in a way that most people are not. They perform euthanasia. They lose patients. They carry the grief of animals who didn't make it and the grief of the families who loved them. Without adequate support and processing, this accumulation of grief can become crushing. Organizations like Not One More Vet have emerged in recent years to directly address this crisis. NOMV was founded in 2014 following a wave of suicides in the veterinary community, and it now provides peer support, mental health resources, and advocacy for systemic change in the profession. The organization's founding was itself a grief response, a community saying we cannot keep losing each other and we have to start talking about why. Talking about it, honestly, openly, without shame, is where healing begins. And it's what we're doing right now. Of all the things that make animal care work emotionally complex, euthanasia may be the most profound. It is also one of the least talked about, at least outside the walls of veterinary clinics and animal shelters. Let's start with what euthanasia is and what it is meant to be. The word itself comes from the Greek, a good death. That is the aspiration at the heart of humane euthanasia, to end suffering with compassion, with dignity, and with the least possible pain. For animals who are experiencing irreversible pain or a catastrophic decline in quality of life, euthanasia is an act of profound mercy. It is, as many veterinarians describe it, one of the greatest gifts the profession can offer. And yet, giving that gift has a cost. For veterinarians and vet technicians who perform euthanasia regularly, the cumulative emotional weight can be staggering. In a busy small animal practice, a veterinarian might perform euthanasia several times a week, sometimes several times in a single day. Each procedure requires the practitioner to hold space for a grieving family, to manage the technical aspects of the procedure with precision, and to maintain composure in the presence of profound loss. And then, often within minutes, to walk into the next exam room and be fully present for the next patient. The ability to do this, to move between grief and care, between loss and healing, without falling apart, is genuinely remarkable. It is also not sustainable without support. Researchers who study veterinary mental health have identified a specific form of distress related to euthanasia that goes beyond general compassion fatigue. It has been called euthanasia-related stress, and it encompasses several distinct experiences. There is the grief of losing a patient, even one you've only just met. There is the weight of being trusted with the most intimate moment in a family's relationship with their animal. There is the moral complexity of cases where the decision to euthanize is not clear-cut, where financial limitations, family disagreement, or uncertainty about prognosis make the decision agonizing rather than merciful. And then there is what shelter workers face, which is different in character, but no less heavy. In animal shelters, some staff may be required to euthanize healthy or treatable animals because there is no space, no resources, or no adopter. This represents one of the deepest sources of moral distress in the animal shelter profession. Workers who entered shelter work to save animals find themselves, through no fault of their own, in the position of ending lives that could have been saved under different circumstances. The dissonance between their values and their actions can be unbearable. A study published in the Journal of Applied Animal Welfare Science found that shelter workers who performed euthanasia reported significantly higher levels of traumatic stress symptoms, burnout, and turnover in tension than those who did not. The act of euthanasia itself, repeated over time, was one of the strongest predictors of psychological harm in the shelter workforce. So how do animal care workers carry this? How do you perform an act that is simultaneously merciful and heartbreaking, and do it again and again without losing yourself? The honest answer is, many of them don't. Many leave the profession. Many develop symptoms of secondary traumatic stress or post-traumatic stress disorder. Many self-medicate, and still many become numb. Not because they stop caring, but because the nervous system has a limit to how much grief it can process without rest. But there are also those who find ways to carry it with grace. Practitioners who have developed rituals of acknowledgement. A moment of silence, a written record, a small ceremony of recognition that honor the life that has ended. Practices that build in debriefing time after difficult cases, where staff can process together rather than alone. Supervision models borrowed from human health care, where practitioners have access to structured emotional support. And increasingly, the community of peers who have been through the same experiences, who understand in a way that family and friends outside the profession simply cannot. The weight of the final gift is real, but it does not have to be carried alone. We've talked about the illusion and the reality of animal care work. We've looked honestly at the mental health crisis in veterinary medicine. We've sat with the weight of euthanasia and what it costs the people who provide it. But it's important to understand that many people who enter animal welfare do so, at least in part, because animals have been a source of healing in their own lives. Maybe you grew up in a difficult household and your dog was the one consistent source of safety and comfort. Maybe you struggled with social anxiety or depression and animals were easier to connect with than people. Maybe you experienced trauma and the wordless companionship of an animal was what got you through. Maybe you simply discovered at some point that the presence of animals made you feel calmer, more grounded, more like yourself. This is not unusual. The therapeutic relationship between humans and animals is well documented. That's what this entire podcast is about. Animal-assisted therapy is a legitimate clinical modality. Equine therapy, dog-assisted interventions, and the presence of therapy animals in hospitals and care homes. These things work because the human-animal bond is genuinely healing. But here's where it gets complicated. When you choose a career in animal care as an extension of that healing relationship, the stakes become very high, and the profession is not always designed to support that. There is something that psychologists call vicarious resilience, the way that helping others can actually strengthen your own capacity for healing. And there is also vicarious trauma, the way that being repeatedly exposed to suffering, even secondhand, can wound you in ways that mirror the original trauma you are trying to heal from. Animal care workers who have their own trauma histories may be especially vulnerable to this. The suffering of the animals they work with can activate their own pain in ways that are difficult to recognize and even harder to manage. Let's recognize the profound complexity of human motivation and of the ways in which our deepest strengths and our deepest vulnerabilities are often the same thing. What it means practically is that people who work in animal welfare who are drawn to the profession for personal healing reasons may need a different kind of support than those who are not. They may benefit from therapy that addresses both professional stress and personal history. They may need mentors and supervisors who can help them distinguish between professional care and compulsive rescue. They may need permission, explicit, repeated permission, to take care of themselves, to set limits, to recognize that they cannot pour from an empty vessel. And the profession itself needs to make room for this. We need a culture that says, it is okay to need help. It is okay to not be okay. It is okay to be a person with a history and a nervous system and limits, who also happens to love animals and want to heal them. Because the animals need us, and we cannot be there for them if we are not there for ourselves. We've covered a lot of ground today. We've talked about the gap between the dream of animal care work and its daily reality. We've looked at the data on suicide in the veterinary profession, data that is hard to hear, but that we need to hear. We've sat with the complexity of humane euthanasia and what it means for the people who perform it. And we've explored the profound, often unspoken way that many animal care workers are seeking their own healing through this work. I want to close with this. If you are an animal care worker who is struggling right now, who is exhausted, who has lost the joy that brought you to this profession, who is questioning whether you can keep going, I want you to hear this clearly. What you are feeling is not weakness. It is not a character flaw. It is not evidence that you chose the wrong path. It is the natural human response to doing profoundly difficult work. You deserve the same care and compassion that you extend to the animals and the families you serve. You deserve to ask for help. You deserve to receive it. If you are in crisis or concerned about someone who is, please reach out right now. In the United States, you can call or text 988 to reach the Suicide and Crisis Lifeline. You can also find peer support and mental health resources specifically for veterinary professionals through Not One More Vet. For those in the United Kingdom, the Vetlife helpline is available around the clock. You can find the websites for Not One More Vet and the Vetlife helpline in the show notes. If you are not in crisis, but are recognizing yourself in what we've talked about today, the burnout, the compassion fatigue, the moral distress, the way the work is entangled with your own healing, please consider reaching out to a mental health professional who works with medical or helping professionals. You don't have to be in crisis to deserve support. You just have to be human. To everyone listening, thank you for the work you do. Thank you for showing up day after day for animals who cannot speak for themselves. The world is genuinely better because you are in it.